Dear Plus Plus ambassadors, welcome to the product training of Plus9. What is the indication that we will focus on today? There are 4 different indications, but they are all related to progesterone during pregnancy. 1. Luteal phase defect. 2. Threatened abortions. 3. Habitual abortions. And 4. Preterm labor. Let's understand the meaning of these indications. Luteal phase defect. The luteal phase is a stage of menstrual cycle after ovulation and before period starts. Luteal phase defect occurs when ovaries are unable to produce required quantities of progesterone and the uterus lining fails to respond to progesterone. Thus, luteal phase defect is an ovulatory disorder that is implicated in infertility and recurrent spontaneous abortion. Threatened abortion. If a woman is pregnant, but she experiences vaginal bleeding in the first 20 weeks of pregnancy, and the bleeding is also accompanied by abdominal cramps, these symptoms indicate that a miscarriage is possible, which is why the condition is known as a threatened abortion or threatened miscarriage. Habitual or recurrent miscarriage. 2 or more consecutive pregnancy losses before 20 weeks of gestation. It is called recurrent pregnancy loss or RPL. Preterm labor. As you can see in the diagram, a typical pregnancy lasts 40 weeks. However, if labor pain occurs between 23 weeks to 37 weeks of pregnancy, it can be termed as preterm labor. Note, most preterm or premature births occur in the 34 and 37 weeks of pregnancy. What is the size of the market for above said indications? Luteal phase defect. Around 3 to 20 of women with infertility problems have some level of luteal phase dysfunction. Threatened abortion. Nearly 1/3 of women experiences threatened abortion. RPL. About 25% of all pregnancies are aborted early. Of these, only 10% are premature birth, when the child can be saved. Preterm birth. 1 in 10 babies are born prematurely. That is, in India, 3.5 million babies are born prematurely every year. Did you know preterm birth is the world's #1 cause of newborn deaths? What is the need for women experiencing luteal phase defects, threatened abortions, recurring pregnancy loss, or preterm labor? Pregnancy is a beautiful phase of a woman's life. She needs a safe medicine to extend her pregnancy for 9 months. Like seeing that extra pink color on a pregnancy test, miscarriage or preterm birth changes her life in an instant. Let's discuss the current practice and if there are any gaps. The current practice is to prescribe 17-alpha-hydroxyprogesterone caproate. 85% of gynecologists prescribe 17-alpha-hydroxyprogesterone caproate. They generally dispense this product. Each doctor has the potential to generate at least 12 UX per month. As per IQVIA data, more than 80% market is captured by only 2 brands. Proluton by Zydus Cadila and Maintain by Jackson Powell. This is a good molecule for the said indications. It is given in 250 mg and 500 mg doses. Let's talk about competition. 85% of doctors have the potential to prescribe 17-OHPC. Competition with only 2 major brands in India. Now calculate what can be the potential of 17-OHPC in your headquarter. See this table for direct competitors of 17-HPC and their rates. That said, you must be aware of some indirect competition as well. This is primarily in form of aqua-based formulations or micronized progesterone. Plus Life Sciences introduces Plus9 17-alpha-hydroxyprogesterone caproate for a safe 9-month pregnancy. Details of the molecule. 17-alpha-hydroxyprogesterone caproate or 17-OHPC is synthetic form of the natural progestin. It has selective agonist of the progesterone receptor with minimal or no other hormonal activity. Thus, it does not give side effects related to androgen, estrogen, or corticosteroids. How does Plus9 work? The exact mode of action is still unknown, but a recent research article has proposed its mode of action. It decreases inflammation and inhibits uterine activity. It has a prolonged duration of action because of oil-based depot effect. Some competitors also provide the same formulation in aqua and alcohol base, which has poor solubility and delivery system. A depot injection is a term for an injection formulation of a medication which releases slowly over time to permit less frequent administration of a medication. See the diagram to understand better. Recommended dose as per guidelines. Preterm delivery prophylaxis, 250 mg IM once weekly. Treatment of amenorrhea, 375 mg IM as a single dose. Abnormal uterine bleeding, 375 mg IM as a single dose. For the treatment of inoperable, recurrent, and metastatic endometrial cancer, 1000 mg or more per week. Prescription habit in India is different from the guidelines. Most doctors prescribe a fixed dose of 250 mg via intramuscular injection weekly, starting from 16 to 20 weeks of gestation and to be continued until 37 weeks of gestation or delivery, whichever occurs first. Sometimes doctors start 250 mg immediately after the pregnancy is medically confirmed, depending on the condition of pregnant women. Some doctors use 500 mg as per their experience and condition of pregnant women. Packaging. Plus9 is available in two strengths, 250 mg and 500 mg. Light pink box is 250 mg IM injection, and deep pink box is 500 mg IM injection. Note, these are sterile unipacks containing the ampoule, pre-sterilized syringe and needle. Manufacturing. Plus9 is manufactured by Linus Life Care Private Limited in Solon. The manufacturing unit is dedicated for hormonal formulation, which is WHO GMP certified, GLP certified, ISO certified. Plus9 is manufactured by one of the largest manufacturers of this molecule. It comes with a promise of highest quality and efficacy. The syringe and needle are strong and easy to use by the physician. The expiry of the injection is 2 years. Cost of Plus9. Plus9 250 cost 173 rupees and Plus9 500 cost 290 rupees. This rate is comparable to other brands in the market. See table for details. How does Plus9 benefit the patients? Plus9 has an excellent safety profile. It is oil-based to allow the body to easily absorb. It is a painless formula as compared to other brands. Unique selling points for the customer. Plus9 brings 17-alpha-hydroxyprogesterone caproate. Most trusted molecule for 5 decades. It is US FDA approved for the prevention of recurrent spontaneous preterm birth. ACOG's clinical guidance recognized in prediction and prevention of preterm birth. It has an excellent safety and efficacy profile. Plus9 is manufactured in dedicated hormonal formulation plant, which is WHO GMP certified. Plus9 in a nutshell. Indications: luteal phase defect, threatened abortion, habitual abortion, preterm labor. Benefit to patients: excellent safety and efficacy profile. Oil-based to allow easy absorption. Painless formula as compared to many other. Dosage: weekly intramuscular injection. Start from 16 to 20 weeks of gestation and to be continued until 37 weeks of gestation or delivery. USB. Most trusted molecule for 5 decades. It is US FDA approved for the prevention of recurrent spontaneous preterm birth. ACOG's clinical guidance recognized in prediction and prevention of preterm birth. It has an excellent safety and efficacy profile. PLUS is manufactured in dedicated hormonal formulation plant, which is WHO GMP certified. Cost of therapy. +9 250 mg is 173 rupees and +9 500 mg is 290 rupees. Ask, dear doctor, prescribe +9 to all your patients with luteal phase defect, threatened abortion, habitual abortion, and preterm labor. Thank you. +9 is a well-trusted molecule prescribed by most gynecologists in India. You can reach out to as many customers in your territory and get business of +9 by highlighting its benefits such as quality, efficacy, and painless injection.